The London School of Hygiene and Tropical Medicine is particularly interested in the health dimensions of illicit drug economies, not only just for people that are using drugs, but people that are producing, trafficking, the drug economy, the implications of that drug economy on a whole range of kind of health and social outcomes. I think if you look into the literature, people would automatically assume that drug economies lead to high rates of drug use. In some of the countries that we'll be working in, there's also an association of drug use with HIV. It's very prevalent amongst people that are injecting drugs, but there's a whole range of other things that kind of play out in the context of health and the context of economies. So I think we're particularly interested in trying to situate health as it relates to drug economies and economies that are coming into transition or hopefully moving from narcotic dependent economies to illicit economies, from war to peace. And in that kind of transition process, what can we do to ensure that health is situated as improving, and people have options and control and agency in the context of delivering health solutions or health interventions? We're not going to get very far unless we actually have the people that are directly affected engaged in those interventions. So we need to be able to mobilise people, collectivise people to kind of be able to give themselves every opportunity of promoting their own health and well-being. I don't think we really know the full dimensions of health in the context of this project and of illicit drug economies more generally, but I think that by the end of this, we'll be able to contrast and compare across different countries angles and aspects of health dimensions of illicit economies, and I think that helps bring the project into a truly multidimensional and multidisciplinary framework, and will allow the project to not only talk about how we go from instability to stability, but how do we ensure health and human rights at the same time. And I think that's very exciting.